and I am here today to speak about the bill H.R. 728 and advanced nursing degrees. After this presentation, the learner should be able to identify key components of H.R. 728, define the role of the clinical nurse leader, identify the benefits of clinical nurse leaders, identify the financial implications of implementing the presented practice change, and determine the sustainability of the presented practice change. The purpose of this presentation is to define the role of the clinical nurse leader and explain why they should be utilized on every inpatient unit at an acute care hospital. So what is H.R. 728? H.R. 728 is a bill entitled Title VIII Nursing Workforce Reauthorization Act of 2019. It is sponsored by Republican Representative David Joyce of Ohio and was first introduced into the 116th U.S. Congress on January 23, 2019. It was passed in the House on October 28, 2019, and is currently awaiting passage in the U.S. Senate. The focus of the bill is on providing grants for nurse career advancement through advanced degrees. So what exactly does H.R. 728 entail? H.R. 728 expands specific nursing workforce development programs through fiscal year 2024. It includes loan repayment and scholarships for nurses obtaining advanced degrees. It expands the advanced education grant eligibility to include clinical nurse leader and clinical nurse specialist programs. It provides grants for increasing nursing workforce diversity and supports internships and residency programs that are focused on mentorship and the development of specialties. The Institute of Medicine put out a report entitled The Future of Nursing, Leading Change and Advancing Health in 2011. In this report, the Institute of Medicine identified the need for a fundamental change of the nursing profession. These changes included advancing nursing education and encouraging nurses to obtain advanced degrees, increasing interprofessional communication and cooperation, as well as identified the need for improved data on the healthcare workforce. The next Institute of Medicine report on nursing is expected in spring of 2021. These changes mentioned can be made through the utilization of clinical nurse leaders. Before we move on, let's define the role of clinical nurse leader. The role of the clinical nurse leader, or CNL, was first introduced in 2003 and was the first new nursing role to be defined in over 35 years. It was developed to improve the quality of patient care outcomes. As defined by the American Association of Colleges of Nursing, a CNL is a master's prepared generalist clinician. They work at the microsystem level, which is typically just one unit in a hospital. They are an additional nurse on that unit and are not meant to carry a patient assignment. Instead, they focus mainly on outcomes measurement, care coordination, quality improvement initiatives, and interprofessional communication. For my nursing practice change, I am going to talk about implementing a CNL on staff at all times for each unit in an acute care hospital. I chose this nursing practice change because I have seen how clinical leaders can improve a unit. I currently work at Hartford Hospital as a clinical leader on the inpatient oncology unit. Hartford Hospital doesn't use the term clinical nurse leader and instead uses the term nurse clinical leader because we are not all master's prepared nurses and are not certified to be true CNLs. Hartford Hospital utilizes its nurse clinical leaders in many of the same ways CNLs are used. On my unit, we are each assigned to quality improvement initiatives. When we are the clinical leader working on any given day, we are assigned the resource nurse role and do carry a small patient assignment. The nursing standards related to this practice change are as follows. Standard 3. Outcomes identification. The graduate level prepared nurse provides consultation to influence the identified plan, enhance the abilities of others, and affect consumer or the situation. CNLs work with other members of the healthcare team to improve patient outcomes. Standard 5A, coordination of care. The registered nurse coordinates care delivery. CNLs work to improve coordination of care and decrease fragmented care. Standard 6, evaluation. The registered nurse evaluates progress toward attainment of outcomes. CNLs are constantly evaluating patient outcomes and questioning how we can improve our current nursing practice. Standard 9, evidence-based practice and research. The registered nurse integrates evidence and research findings into practice. CNLs are constantly consulting the literature to improve care and implement evidence-based practice. Standard 12, leadership. The registered nurse demonstrates leadership in the professional practice setting and in the profession. CNLs are a leader not only on their unit, but in their organization as a whole. And finally, Standard 13, collaboration. The registered nurse collaborates with healthcare consumer, family, and others in the conduct of nursing practice. The CNL places a large focus on improving interprofessional communication and collaboration with all members of the healthcare team, including patients and their families. For ethics related to this practice change, I chose the following provisions. Provision 3. The nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. The CNL is always focused on improving patient outcomes and advocating for patients. Provision 5. The nurse owes the same duties to self as to others, including the responsibility to preserve integrity and safety, to maintain competence, and to continue personal and professional growth. The CNL is always looking to improve themselves and their nursing practice, as well as those around them. Provision 6. The nurse participates in establishing, maintaining, and improving healthcare environments and conditions of employment conducive to the provision of quality healthcare and consistent with the values of the profession through individual and collective action. The CNL is always working to improve healthcare. And finally, Provision 7. The nurse participates in the advancement of the profession through contributions to practice, education, administration, and knowledge development. The CNL is always working on quality improvement initiatives to continue to improve our nursing practice. So who would this practice change affect? The affected patient population would be any patient admitted to an inpatient floor at an acute care hospital. The key stakeholders of this practice change are nurses on these units, as well as the nurse managers, educators, and directors at the hospital. Another stakeholder to consider is the general public, as CNLs help with improving patient outcomes and improved population health as a result. So why is this practice change important and needed? As you can see, many of these areas list the same reasons why this change is important, and that's because the simple act of improving patient outcomes can have such a large positive effect. Sociopolitically, this change is important because CNLs are focused on improving patient care delivery and can help with improved access to care. In her article, Clinical Nurse Leader, A Role for the 21st Century, Rankin spoke of a CNL who investigated why a patient had stopped taking his blood pressure medications. He told her his doctor had dropped him as a patient because the office no longer was covered by his insurance. The CNL was able to call his insurance company and set him up with an appointment with a new primary care provider. CNLs help to improve patient outcomes, which has ethical, legal, financial, and clinical implications. Ethically, nurses are always to do the best thing for their patients. Legally, with improved patient outcomes, which can also be caused by a decrease in fragmented care, there is less harm done to patients. Financially speaking, decreased fragmented care and improved care coordinating can lead to increased cost savings. Finally, clinically, CNLs can lead to a decrease in hospital-associated events, such as hospital-acquired pressure injuries, patient falls, venous thrombosis events, and catheter-associated urinary tract infections, which leads to improved outcomes. Before we move on, let's define fragmented care. Fragmented care is poorly coordinated care and has been found to contribute to anywhere from 44,000 to 98,000 deaths each year that are caused by medical errors. CNLs work on quality improvement initiatives that combat fragmented care and lead to improved patient outcomes. When researching the benefits of implementing clinical nurse leaders, I found that several medical centers had already conducted their own research when implementing CNLs into their organizations. In a study done when implementing the CNL role at a Level 1 trauma center in the southern United States, it was found that units with a CNL showed a 30 to 82% improvement in the number of patient falls, catheter-associated urinary tract infections, central line associated bloodstream infections, and hospital-acquired pressure ulcers from 2010 to 2015. Similarly, at Carolinas Medical Center, units with a CNL showed a 53% reduction in central line infections, a 59% reduction in deep vein thrombosis, a 47% reduction in catheter-associated urinary tract infections, a 63% decrease in falls, and greater than a 5% reduction in nursing turnover rates. These decreases led to a $3 million cost savings. CNLs help lead quality improvement projects that can lead to cost savings and improved outcomes. For example, at a Level 1 trauma center, a CNL and a perioperative clinical nurse specialist worked together to change where patients were cared for immediately following a renal transplant. Rather than being taken to the surgical intensive care unit, these patients were instead sent to a general medical surgical unit. This led to a 50.9% decrease in cost per patient day due to the elimination of the cost of an ICU stay. They also saw improvements in average length of stay, mortality, and readmission rates. The financial implications of this bill include paying the salary of the CNL, who will be an extra nurse working on each unit each day. In general, $221 million has been allocated for HR 728 annually for fiscal years 2020 through 2024. This includes $78 million for advanced nursing education grants, $18 million in workforce diversity grants, $44 million for nurse education, practice, and quality grants, and $91 million for loan repayment and scholarship programs. Ultimately, the benefits of this practice change are similar for stakeholders and patients. Implementing CNLs leads to improved patient outcomes and care coordination. This leads to increased cost savings, which benefits stakeholders, and improved patient satisfaction, which benefits the patients. In order to evaluate the effectiveness of this practice change, I would track data over a 2-year period for nurse-driven quality indicators. These include patient falls, deep vein thrombosis events, hospital-acquired pressure injuries, catheter-associated urinary tract infections, and central line infections. I would also track patient satisfaction scores over this 2-year period. Then I would compare this data to the data collected before implementing CNLs. I would then report these positive results within the organization as well as outside of the organization. I would send out a report with this data from the previous slide in an email to all staff at the hospital, as well as include it in the annual nursing report Hartford Hospital puts out to its employees. As far as outside the organization goes, I would include this data on the hospital website to show how we have been making improvements. How sustainable is this practice change? That all depends on the number of nurses going for advanced degrees. So long as there are enough master's prepared nurses, this practice would be very sustainable for the hospital. Here are the key takeaways of this presentation. HR 728 is a bill focused on providing grants for nurse career advancement through advanced degrees. Clinical nurse leaders are master's prepared generalist clinicians. CNLs should be implemented in each inpatient unit at an acute care hospital. And CNLs participate in quality improvement initiatives leading to improved patient outcomes. And finally, here are my references for this presentation. Thank you for your time.